Hello, Andrea Turowski here with Dentalelle Tutoring. Welcome back. Let's talk about CAMBRA, so the Caries Risk Assessment Tool. So you're seeing clients and your particular client, they have a very high caries risk. This is what you've determined in the assessment phase. Now, what did you assess that gives them that high caries risk? Maybe they have a low caries risk. Maybe they have a moderate. Maybe they have an extreme. Maybe they have a high. So we're going to talk about that today and what you need to know for the board exam. So what is it about CAMBRA, the Caries Risk Assessment Tool, that you have to know? So I'm just going to pop up my study guide here. So if you're part of the study guide package or the express package or the VIP package in Dentalelle, you will have this study guide for you to go through in our board exam prep courses. So everything that I'm talking about today, I make it very, very simple, and I do have it all here for you. If you want to kind of read through it on your own, that's kind of what I'm going to be doing for you guys now. So I'm going to read through this for you, and I don't want to forget to mention something. So I'm going to briefly look at the study guide as well. So basically, what are some caries indicators? This is what you have to know about CAMBRA. Now, what does CAMBRA stand for? Caries Management by Risk Assessment. This is an evidence-based approach to the prevention of cavities and the treatment of cavities. It's no longer good enough to say that your client has cavities, now they need fillings, book them in for their next appointment. No, you need to look at everything and really prevent those cavities from happening. What is it that's causing those cavities? Is it they're not brushing well, or maybe they're brushing really well, but they're using the wrong toothpaste? Maybe they don't believe in fluoride and they're not using fluoride. Maybe they get 5 cavities every time they come in, but they tell you they're brushing perfectly. They just don't understand why. So you need to look at certain things. Now, what do we look at that indicates caries? Are there white spots on the teeth? A lot of people think about cavities as, dark spots or black spots or brown spots or even just a big hole. But you also have to think about white spots. I would say I notice white spots on the teeth more than anything. What this means is that the teeth aren't getting the minerals they need, and or the plaque could be sitting there too long, starting to eat through that enamel, but just hasn't had a chance to yet. But give it a day, give it a couple weeks, and it's going to start to eat through. If those white spots become soft, so not just white spots on hard enamel, but if the white spots become soft, that's not good. They have a cavity. They're likely quite sensitive at this point, and as a dental hygienist, we actually don't want to clean those off until they know they have an appointment to get those areas filled, because we can actually be making it worse, as silly as that sounds. So we need to know the different type of lesions. For the board exam, for dental hygiene and dental assisting students, you need to know caries disease indicators. If you're in our board exam prep course, I go through this with you. Don't worry, and I'm going to briefly do it now, as I've mentioned. So white spots, and what about they've had fillings done within the past 3 years, they've had cavities in between the teeth, and they have cavities that are even going into the enamel. So even if there's one cavity where they've told you, my dentist told me last time that this cavity could be hitting a nerve soon, that is saying they've had a deeper cavity. What if you look at the x-rays and they have a mouthful of fillings? This is a caries indicator. But then we have to look at, and I'm going to pop this up for you guys, then we have to look at the pathologic factors. So do they have a very high bacteria count? Do they have a lot of plaque? Do they like to have snacks often? Okay. Do they not have enough saliva? If there's not enough saliva due to whatever reason, it can be much easier to get cavities. What if they have gingival recession? That enamel layer is now gone and the second layer is now exposed. So even if there's a little cavity on gingival recession on that area, it's going to spread a lot more quickly, like it's going to spread fast. What about orthodontic appliances? Do they have braces? It's very easy for plaque to stick there. It's very easy for it to get bad fast as well. But then we also talk about the protective parts of it too. So Again, it's not just good enough to tell a patient they have a cavity, they have 5 cavities, you're coming in 2 weeks to get those cavity fixed, see you later. We need to tell them, you know what, you need to be drinking more water. This will help to neutralize the acids inside the mouth and prevent more cavities. If they tell you they're brushing once a day, well, you need to tell them you need to brush at least twice a day, and make sure to use a toothpaste with fluoride, even to add xylitol, and that will help even more to protect those teeth. What about a mouthwash? Also use a mouthwash that contains fluoride and xylitol. So do whatever you can to limit those cavities from coming back and help to even fix the cavities that are present. Did you know if it's a very tiny cavity, we like to call it incipient caries. If it's very small, if a patient starts brushing really well, they use a fluoridated toothpaste, a mouthwash, and they just do a really good job to clean that area, that cavity could actually reverse. That cavity could go away, but the key is it has to be small enough. Once it's through the next layer of the tooth, even if you're doing whatever you can, using toothpaste, brushing 5 times a day, using a mouthwash, that cavity can't go away because it's too far gone. But smaller ones can. But then also talk to them. Maybe they need to have their teeth cleaned at the dental office more often. Maybe there's certain treatments we can put on their teeth, kind of like a good hair conditioner, you know, certain treatments you would put on your car to just do everything better. There are treatments we can put on their teeth to help to prevent against cavities. If they get a lot of cavities, plus you have come to determine they don't have a lot of saliva, or maybe the proteins in their saliva isn't good, you might even prescribe something. There are certain mouthwashes that can be prescribed. So as you guys can see here, there's lots to know, and this is all inside your study guide, inside the board exam prep course. So for CAMBRA, you guys, so I've mentioned it here, but you need to know about the Caries disease indicators. You need to know about the pathologic factors. You need to know about the protective factors, but what I've also forgot to mention, sorry, is you need to determine, are they at low risk, medium, high, or extreme? So I go through all of that. Let's say they're at low risk. Well, then you don't have to go through the whole shebang that I just talked about, because they've never had a filling, they've never had a cavity, they're 35 years old. You don't have to go crazy talking to them about how cavities form, using the right toothpaste, using the right mouthwash, this and this and this, because they're clearly doing something right if they're in their 30s and they don't have a cavity. But what if they're 30 and they just got their first cavity and they're confused at, why do I have a cavity? I've never had a cavity before. Upon talking to them, they might explain to you, well, now more than ever, they like to snack in between meals, or they admit to not drinking enough water, or they forgot their toothbrush when they went camping, so they didn't brush for 2 weeks. I don't know. Then you can explain to them, well, that's probably how you got the cavity, but let's talk about how to prevent them from now on. Let's talk about different things we can do. So those are all the things you need to know for CAMBRA, okay? So I was kind of showing you guys the study guide here that I do offer if you sign up for any of the Board Exam Prep Academy packages. Again, it's not something you have to do, but if you're looking to take the board exam, I highly recommend it. What I like about these study guides is, as you guys can see, I have them per topic. So you can go through the entire topic, and then I'm just going to zoom in here again. You can take mock exam practice questions. So there's questions, and then at the end you will see answers and rationales for that topic. So I don't just give you the answer, but I give you the answer and the rationale for every question. So you know which one is the right answer, which is the wrong one, and then you kind of go from there. So it's amazing. There is a study guide package. There's an Express Board Exam Prep Academy package, which is the next one, and then there's a VIP package. I will leave the link for you guys down below. It is at the website dentalelle.com. Learn more if you want to see kind of all of the packages there. We have a website for Canadian students and also a website for States students as well, to help you guys study for the board exam. With a 99.7% success rate, I know I can help help you pass. This is my full-time job. You can reach out to me, ask me questions anytime. I am always here to help. So I hope this helped about the caries management. If you're on Instagram, make sure to follow Dentalelle because I will be uploading this like little infographic actually in just a couple minutes that I have made for everybody talking about CAMBRA, just kind of summarizing everything I talked about if you wanted some quick studying. I do sort of like infographics like this, like this often. So it just kind of helps really easy studying, quick studying, and I kind of like to try to make it more fun too. So thank you guys for watching, and I'll see you in the next one. So are you thinking about becoming a mobile dental hygienist, meaning you're not going to work for a dentist anymore, you're not going to purchase your own standalone practice like a physical location, but you're either going to see patients in your own home, I can see patients